Hi, Dr. Marlene, physical therapist here, talking about baby crawling styles and what they mean for your baby's development. Here we have our traditional hands and knees crawling. As you may already know, this helps build your baby's core strength, coordination, and cross body movement since they're having to use one leg and the opposite arm and then switch. So it really helps with that brain development and getting both sides of the brain to communicate with each other, among other things. Next, we also have army crawling, which your baby will probably do before they learn how to do traditional crawling. And this is a great way for your baby to build their upper body strength. And he's even using his legs a little bit to propel himself forward. But if the army crawl is persistent and you never see them progressing towards hands and knees, which might just be being on hands and knees without actually crawling and kind of going in that direction, it could signal a weak core or leg muscles. And sometimes babies can be a little bit delayed. Not every baby progresses at the same rate, but just keep an eye on that. We also have the bottom scoot, the booty scooting. As you can tell, that is not a cute baby. That is me demonstrating that. Some babies prefer to scoot instead of crawl, and while it's cute, it may indicate weaker hip and core muscles. If they do it once in a while, here and there, it's okay. It's not their primary mode of mobility. Don't worry about it. But if that's all that they're doing, then I would definitely seek out a physical therapy evaluation. And then we have the one-sided crawl, where one leg is up and the foot is planted while the other leg is down and the knee is planted. And you'll probably notice if your baby does this, it's always that same leg that is up. This is an asymmetrical crawling pattern, which could indicate that there is a muscle imbalance or tightness on one side. And again, if you see them do it temporarily, once in a while, not a big deal. But if they're doing it all the time, then I would definitely seek out that evaluation. And there's also the bear crawl, which your baby might actually, this could probably be considered like a mini milestone because your baby might do this before they learn to get to standing. And I don't mean that you don't want them to bear crawl all the time and they're never doing hands and knees, but as they start to get stronger, they'll probably do this right before trying to attempt to stand up or to climb up into a standing position at furniture. So that is totally normal. But if you feel like your baby skipped crawling and is just bear crawling, then they might have like a sensory thing where maybe their knees feel weird on the ground, so they're trying to keep their knees up, or they like the sensory input to the bottoms of their feet because of the extra weight bearing that's happening at their toes and their forefoot. So if you feel like they're doing this too much, then I would definitely consult with the physical therapist to see if this is an issue or not. But more than likely, it could just be a normal stage as they learn to come up to stand. But we definitely want that hands and knees crawling to start off with. So even though it might be tempting to skip ahead to walking, crawling is really important because it does provide a foundation for balance, coordination, strengthening that not only helps with those higher level gross and fine motor skills that are to come later on, like walking and running. And like I mentioned before, it helps with brain development. You want your baby to have that practice of the opposite sides of their brains communicating with each other, which that cross lateral movement of one arm, one leg, and then switching to the opposite arm and leg. That's important. This also helps promote balance and body awareness because when they're in that crawling position and they release one arm to play with a toy, they're really working on their core and knowing where their body is in space, also where they're trying to focus on objects and toys while they're moving. So it also helps with the visual system. So please, please, please give your baby as many opportunities as they can to crawl on hands and knees. And some ways that you can work on promoting traditional crawling is by using one of those tunnels. So that's a great way to help promote hands and knees crawling and work on that core strength. And I love doing obstacle courses with pillows, cushions, just crawling over low objects using the boppy pillow up and over. It helps activate both sides of the body. And tummy time, of course, it strengthens the core muscles and promotes even weight distribution, but also they can shift on their tummy to reach for different toys. Depending on where you put them. So you could strategically put some toys a little bit further away that they have to shift to one side to get. And sideline propped on an elbow, and then even the opposite leg kind of bent and the foot on the ground. That's a great way to play, but if your baby's already mobile, he probably won't let you position him or her like this. This is more of that army crawl prior stage to kind of help work on that core strengthening. I also like to play in ring sitting. So they get their hips are in a nice position and they're able to shift their weight with your help, depending on their age and if they're already prop sitting or sitting on their own. But again, placing those toys strategically left, right, middle. And then from ring sitting, with reaching for a toy, they can go into side sitting and have one arm propped as they reach for different toys. And definitely do both sides if you're working on sideline or you're working on trying to get them to side sit to reach. You definitely want to do both sides of the body, not just one, because we want to work on that symmetry as much as we can. And I am curious, what kind of crawler do you have? How is your baby crawling right now? And do you need any tips or tricks to see how you can help promote a traditional crawling pattern? My name is Dr. Marlene, physical therapist with Whole Motion Therapy and Wellness. Please like, comment, and share, and follow. Have a great day. Bye.